1. ST segment elevation on an ECG may indicate a myocardial infarction. True or false? Answer: true. Rationale: ST segment elevation on an ECG is a hallmark sign of ST elevation myocardial infarction, STEMI, indicating full-thickness cardiac muscle injury due to coronary artery occlusion, per AHA/ACC guidelines. 2. Myocardial infarction is caused by a blockage in the pulmonary artery. True or false? Answer: false. Rationale: MI results from occlusion of a coronary artery, not the pulmonary artery, leading to myocardial ischemia and necrosis, per cardiovascular pathophysiology. 3. Chest pain radiating to the left arm is a typical symptom of MI. True or false? Answer: true. Rationale: chest pain radiating to the left arm, jaw, or shoulder is a classic symptom of MI due to referred pain from cardiac ischemia, per AHA clinical manifestations. 4. Troponin levels rise within 3 to 6 hours of an MI and remain elevated for up to 14 days. True or false? Answer: true. Rationale: cardiac troponins, I or T, are highly specific biomarkers for MI, detectable within 3 to 6 hours and elevated for 7 to 14 days, per ACC diagnostic criteria. 5. Women are more likely to present with atypical MI symptoms than men. True or false? Answer: true. Rationale: women, especially older adults, often present with atypical MI symptoms like fatigue, nausea, or shortness of breath, per AHA gender-specific guidelines. 6. Nitroglycerin is contraindicated in patients with hypotension during an MI. True or false? Answer: true. Rationale: nitroglycerin causes vasodilation, which can worsen hypotension, systolic BP less than 90 millimeters of mercury, a contraindication in MI, per AHA emergency protocols. 7. Smoking is a modifiable risk factor for myocardial infarction. True or false? Answer: true. Rationale: smoking promotes atherosclerosis and thrombosis, increasing MI risk, and cessation is a key prevention strategy, per AHA risk factor guidelines. 8. A normal ECG rules out myocardial infarction. True or false? Answer: false. Rationale: a normal ECG does not rule out MI, as non-ST elevation MI, STEMI, or early STEMI may show normal or nonspecific findings, per ACC diagnostic standards. 9. The nurse should administer oxygen to all MI patients, regardless of oxygen saturation. True or false? Answer: false. Rationale: oxygen is indicated only for MI patients with hypoxemia, SpO2 less than 90%, as routine use may not benefit normoxic patients, per AHA 2020 guidelines. 10. Aspirin is given to MI patients to reduce platelet aggregation. True or false? Answer: true. Rationale: aspirin 162 to 325 milligrams chewed inhibits platelet aggregation, reducing thrombus formation in MI, a standard emergency intervention, per AHA protocols. 11. Myocardial infarction always results in permanent heart failure. True or false? Answer: false. Rationale: while MI can lead to heart failure, not all cases result in permanent heart failure. Outcomes depend on infarct size and treatment, per AHA complications data. 12. The left anterior descending LAD artery occlusion often causes anterior wall MI. True or false? Answer: true. Rationale: the LAD supplies the anterior wall of the left ventricle. Its occlusion commonly causes anterior wall MI, seen on ECG as ST elevation in leads V1, V4, per coronary anatomy. 13. Beta blockers are given early in MI to reduce myocardial oxygen demand. True or false? Answer: true. Rationale: beta blockers, e.g., metoprolol, reduce heart rate and contractility, decreasing myocardial oxygen demand and infarct size, per AHA pharmacologic guidelines. 14. Diaphoresis is a common symptom of myocardial infarction. True or false? Answer: true. Rationale: diaphoresis, sweating, is a frequent MI symptom due to sympathetic nervous system activation during ischemia, per AHA clinical manifestations. 15. Percutaneous coronary intervention, PCI, is the preferred treatment for STEMI within 90 minutes of hospital arrival. True or false? Answer: true. Rationale: PCI is the gold standard for STEMI, aiming to restore coronary blood flow within 90 minutes of first medical contact, per AHA/ACC reperfusion guidelines. 16. CKMB is more specific than troponin for diagnosing MI. True or false? Answer: false. Rationale: troponin is more specific and sensitive than CKMB for MI diagnosis, as CKMB can elevate in non-cardiac conditions, per ACC biomarker standards. 17. The nurse should monitor for ventricular arrhythmias post-MI. True or false? Answer: true. Rationale: ventricular arrhythmias, e.g., ventricular tachycardia, are common post-MI complications due to myocardial irritability, requiring continuous ECG monitoring, per AHA guidelines. 18. Hypertension is a non-modifiable risk factor for MI. True or false? Answer: false. Rationale: hypertension is a modifiable risk factor for MI, manageable through lifestyle changes and medications, per AHA risk factor guidelines. 19. Morphine is used to relieve chest pain in MI patients. True or false? Answer: true. Rationale: morphine reduces chest pain and anxiety in MI, decreasing sympathetic stimulation and myocardial oxygen demand, per AHA emergency protocols, MONA. 20. Elderly patients with MI always present with chest pain. True or false? Answer: false. Rationale: elderly patients may present with atypical MI symptoms like confusion, fatigue, or dyspnea, rather than chest pain, per AHA geriatric considerations. 21. The nurse should teach MI patients to avoid heavy lifting during recovery. True or false? Answer: true. Rationale: heavy lifting increases myocardial oxygen demand, risking further ischemia during MI recovery. Activity restrictions are key, per AHA rehabilitation guidelines. 22. A Q wave on an ECG indicates a previous myocardial infarction. True or false? Answer: true. Rationale: pathologic Q waves on an ECG suggest prior myocardial necrosis from an MI, typically seen in leads corresponding to the infarcted area, per AHA ECG criteria. 23. Thrombolytic therapy is the first-line treatment for all MI patients. True or false? Answer: false. Rationale: thrombolytics are used for STEMI when PCI is unavailable within 120 minutes. PCI is preferred, and thrombolytics are not used for STEMI, per AHA guidelines. 24. Diabetes mellitus increases the risk of myocardial infarction. True or false? Answer: true. Rationale: diabetes accelerates atherosclerosis and impairs coronary blood flow, increasing MI risk, per AHA risk factor data. 25. The nurse should assess for jugular vein distension in MI patients. True or false? Answer: true. Rationale: jugular vein distension may indicate right ventricular failure or cardiogenic shock post-MI, requiring assessment, per AHA clinical evaluation guidelines. 26. MI can lead to cardiogenic shock as a complication. True or false? Answer: true. Rationale: cardiogenic shock, caused by extensive myocardial damage reducing cardiac output, is a life-threatening MI complication, per AHA complications data. 27. Statins are prescribed post-MI to lower LDL cholesterol. True or false? Answer: true. Rationale: statins, e.g., atorvastatin, reduce LDL cholesterol, stabilize plaques, and prevent recurrent MI, a standard post-MI therapy, per AHA guidelines. 28. All MI patients require immediate coronary artery bypass grafting, CABG. True or false? Answer: false. Rationale: CABG is reserved for MI patients with specific indications, e.g., multivessel disease, failed PCI. Not all cases, per AHA surgical guidelines. 29. The nurse should administer heparin to prevent thrombus formation in MI. True or false? Answer: true. Rationale: heparin, or enoxaparin, is used in MI to prevent further thrombus formation and embolization, per AHA anticoagulant therapy guidelines. 30. Nausea and vomiting are atypical symptoms of MI in women. True or false? Answer: true. Rationale: Nausea and vomiting are common atypical MI symptoms in women, often mistaken for gastrointestinal issues, per AHA gender-specific guidelines. 31. The right coronary artery supplies the left ventricle. True or false? Answer. False rationale. The right coronary artery primarily supplies the right ventricle and inferior left ventricle. The left ventricle is mainly supplied by the LAD and circumflex arteries, per coronary anatomy. 32. The nurse should monitor for bradycardia after beta blocker administration in MI. True or false? Answer. True rationale. Beta blockers can cause bradycardia by slowing heart rate, requiring monitoring post-MI, per AHA pharmacologic monitoring guidelines. 33. A history of MI increases the risk of sudden cardiac death. True or false? Answer. True rationale. Prior MI scars the myocardium, increasing the risk of ventricular arrhythmias and sudden cardiac death, per AHA long-term outcomes. 34. MI pain is always relieved by rest. True or false? Answer. False rationale. MI pain, unlike angina, is not typically relieved by rest, as it results from irreversible ischemia, per AHA clinical manifestations. 35. The nurse should teach MI patients to take nitroglycerin for chest pain every 5 minutes up to 3 doses. True or false? Answer. True rationale. Patients with suspected MI should take sublingual nitroglycerin, 0.4 milligrams, every 5 minutes for up to 3 doses if chest pain persists, calling 911 if no relief, per AHA patient education. 36. Elevated LDL cholesterol is a risk factor for MI. True or false? Answer. True rationale. Elevated LDL cholesterol promotes atherosclerosis, narrowing coronary arteries and increasing MI risk, per AHA risk factor guidelines. 37. The nurse should position MI patients flat to improve cardiac output. True or false? Answer. False rationale. MI patients should be positioned semi-Fowlers, 30 to 45 degrees, to reduce preload and myocardial oxygen demand, per AHA nursing care guidelines. 38. An inferior wall MI is often caused by right coronary artery occlusion. True or false? Answer. True rationale. The right coronary artery supplies the inferior wall. Its occlusion causes inferior wall MI, seen as ST elevation in leads 2, 3, AVF, per AHA ECG criteria. 39. Clopidogrel is used to prevent platelet aggregation post-MI. True or false? Answer. True rationale. Clopidogrel, a P2Y12 inhibitor, prevents platelet aggregation and recurrent thrombosis post-MI, often used with aspirin, per AHA antiplatelet therapy. 40. MI can cause left ventricular aneurysm as a complication. True or false? Answer. True rationale. Left ventricular aneurysm, a weakened myocardial wall, can form post-MI, increasing risks of heart failure and thromboembolism, per AHA complications. 41. The nurse should assess for crackles in MI patients. True or false? Answer. True rationale. Crackles may indicate pulmonary edema from left ventricular dysfunction post-MI, requiring assessment, per AHA clinical evaluation guidelines. 42. All MI patients experience ST segment elevation on ECG. True or false? Answer. False rationale. Only STEMI shows ST segment elevation. NSTEMI may show ST depression or T-wave inversion, per AHA ECG classification. 43. Cardiac rehabilitation is recommended for all MI patients. True or false? Answer. True rationale. Cardiac rehabilitation improves functional capacity and reduces recurrent MI risk through exercise and education, per AHA rehabilitation guidelines. 44. The nurse should administer thrombolytics to MI patients with chest pain for over 12 hours. True or false? Answer. False rationale. Thrombolytics are most effective within 12 hours of symptom onset in STEMI. Beyond this, PCI or medical management is preferred, per AHA reperfusion guidelines. 45. MI can cause pericarditis as a complication. True or false? Answer. True rationale. Post-MI pericarditis, Dressler syndrome, can occur due to myocardial inflammation, typically 1 to 6 weeks post-MI, per AHA complications. 46. The nurse should monitor for hyperglycemia in MI patients. True or false? Answer. True. Rationale. Stress hyperglycemia is common in MI due to catecholamine release, requiring monitoring as it worsens outcomes, per AHA metabolic guidelines. 47. A sedentary lifestyle is a modifiable risk factor for MI. True or false? Answer. True. Rationale. A sedentary lifestyle promotes obesity and atherosclerosis, increasing MI risk. Regular exercise is preventive, per AHA risk factor guidelines. 48. MI pain is always described as crushing or squeezing. True or false? Answer. False. Rationale. MI pain varies, described as pressure, burning, or aching, and may be atypical, e.g., epigastric discomfort, in some patients, per AHA clinical manifestations. 49. The nurse should teach MI patients to avoid smoking to prevent recurrence. True or false? Answer. True. Rationale. Smoking cessation reduces MI recurrence by decreasing atherosclerosis and thrombosis risk, a key patient education point, per AHA prevention guidelines. 50. Elevated troponin levels confirm MI within 30 minutes of symptom onset. True or false? Answer. False. Rationale. Troponin levels may not rise until 3 to 6 hours after MI onset, requiring serial testing for early diagnosis, per ACC biomarker standards. 51. The nurse should assess for pallor in MI patients. True or false? Answer. True. Rationale. Pallor is a common MI symptom due to reduced cardiac output and sympathetic activation, requiring assessment, per AHA clinical evaluation. 52. All MI patients require lifelong anticoagulant therapy. True or false? Answer. False. Rationale. Anticoagulants, e.g., heparin, are used acutely in MI. Lifelong therapy is indicated only for specific conditions, e.g., atrial fibrillation, per AHA guidelines. 53. The circumflex artery occlusion can cause lateral wall MI. True or false? Answer. True. Rationale. The circumflex artery supplies the lateral left ventricle. Its occlusion causes lateral wall MI, seen as ST elevation in leads I, AVL, V5, V6, per AHA ECG criteria. 54. MI can be caused by coronary artery spasm. True or false? Answer. True. Rationale. Coronary artery spasm, variant angina, can cause transient ischemia leading to MI, though atherosclerosis is more common, per AHA pathophysiology. 55. The nurse should monitor for hypotension after nitroglycerin administration. True or false? Answer. True. Rationale. Nitroglycerin can cause hypotension due to vasodilation, requiring BP monitoring post-administration, per AHA pharmacologic monitoring. 56. A family history of coronary artery disease increases MI risk. True or false? Answer. True. Rationale. A family history of premature coronary artery disease is a non-modifiable risk factor for MI due to genetic predisposition, per AHA risk factors. 57. The nurse should administer beta blockers to MI patients with severe asthma. True or false? Answer. False. Rationale. Beta blockers are contraindicated in severe asthma due to risk of bronchospasm. Alternative therapies are used, per AHA pharmacologic contraindications. 58. MI can cause mitral regurgitation as a complication. True or false? Answer. True. Rationale. Papillary muscle dysfunction or rupture post-MI can cause mitral regurgitation, leading to heart failure, per AHA complications. 59. The nurse should teach MI patients to follow a low-sodium diet. True or false? Answer. True. Rationale. A low-sodium diet reduces fluid retention and hypertension, preventing heart failure post-MI, per AHA dietary guidelines. 60. T-wave inversion on an ECG always indicates an acute MI. True or false? Answer. False. Rationale. T-wave inversion can indicate ischemia or NSTEMI, but is not specific to acute MI and may occur in other conditions, per AHA ECG criteria. 61. The nurse should assess for dyspnea in MI patients. True or false? Answer: true. Rationale: dyspnea may indicate left ventricular failure or pulmonary edema post-MI, requiring assessment, per AHA Clinical Evaluation Guidelines. 62. All MI patients experience chest pain as the primary symptom. True or false? Answer: false. Rationale: some MI patients, especially women and the elderly, may present without chest pain, with symptoms like fatigue or nausea, per AHA Clinical Manifestations. 63. ACE inhibitors are prescribed post-MI to reduce ventricular remodeling. True or false? Answer: true. Rationale: ACE inhibitors, e.g., lisinopril, reduce afterload and ventricular remodeling, improving outcomes post-MI, per AHA Pharmacologic Guidelines. 64. The nurse should administer thrombolytics to MI patients with a history of hemorrhagic stroke. True or false? Answer: false. Rationale: thrombolytics are contraindicated in patients with prior hemorrhagic stroke due to bleeding risk, per AHA Reperfusion Contraindications. 65. MI can cause ventricular septal rupture as a complication. True or false? Answer: true. Rationale: ventricular septal rupture, a rare but serious MI complication, results from necrosis of the septum, causing a shunt, per AHA Complications. 66. The nurse should teach MI patients to recognize symptoms of recurrent ischemia. True or false? Answer: true. Rationale: educating patients to recognize recurrent chest pain or dyspnea ensures timely intervention to prevent further MI, per AHA Patient Education. 67. Obesity is a modifiable risk factor for MI. True or false? Answer: true. Rationale: obesity contributes to atherosclerosis and hypertension, increasing MI risk. Weight loss is preventive, per AHA Risk Factor Guidelines. 68. The nurse should administer morphine to MI patients with bradycardia. True or false? Answer: false. Rationale: morphine can worsen bradycardia by increasing vagal tone. It is used for pain, not bradycardia, which may require atropine, per AHA protocols. 69. MI can cause right ventricular infarction. True or false? Answer: true. Rationale: right ventricular infarction, often from right coronary artery occlusion, complicates inferior MI, causing hypotension, per AHA Pathophysiology. 70. The nurse should monitor for elevated potassium levels post-MI. True or false? Answer: true. Rationale: myocardial necrosis and medications, e.g., ACE inhibitors, can cause hyperkalemia post-MI, requiring monitoring, per AHA Metabolic Guidelines. 71. The nurse should teach MI patients to take aspirin daily post-discharge. True or false? Answer: true. Rationale: low-dose aspirin, 81 mg daily, is recommended post-MI to prevent recurrent thrombosis, unless contraindicated, per AHA Secondary Prevention. 72. MI pain is always substernal in location. True or false? Answer: false. Rationale: MI pain may be substernal but can also be epigastric, jaw, or arm pain, varying by patient, per AHA Clinical Manifestations. 73. The nurse should assess for S3 heart sound in MI patients. True or false? Answer: true. Rationale: an S3 heart sound may indicate left ventricular dysfunction or heart failure post-MI, requiring assessment, per AHA Clinical Evaluation. 74. All MI patients require an implantable cardioverter defibrillator, ICD. True or false? Answer: false. Rationale: ICDs are indicated for specific post-MI patients with reduced ejection fraction or high arrhythmia risk, not all, per AHA Device Guidelines. 75. The nurse should administer nitroglycerin to MI patients with ST depression. True or false? Answer: true. Rationale: nitroglycerin is used for ischemia in STEMI, ST depression, to relieve chest pain, unless contraindicated, per AHA emergency protocols. 76. MI can cause pulmonary edema as a complication. True or false? Answer: true. Rationale: Left ventricular failure post-MI can cause pulmonary edema, leading to dyspnea and crackles, per AHA complications. 77. The nurse should teach MI patients to avoid excessive caffeine intake. True or false? Answer. True rationale. Excessive caffeine can increase heart rate and blood pressure, stressing the heart post-MI, per AHA dietary guidelines. 78. A posterior wall MI is often caused by left anterior descending artery occlusion. True or false? Answer. False rationale. Posterior wall MI is typically caused by circumflex or right coronary artery occlusion, not the LAD, per AHA coronary anatomy. 79. The nurse should monitor for signs of bleeding in MI patients on heparin. True or false? Answer. True rationale. Heparin increases bleeding risk, requiring monitoring for signs like hematuria or gastrointestinal bleeding, per AHA anticoagulant monitoring. 80. MI can occur without coronary artery occlusion. True or false? Answer. True rationale. MI can result from non-occlusive causes like coronary spasm, demand ischemia, or microvascular dysfunction, per AHA pathophysiology. 81. The nurse should assess for anxiety in MI patients. True or false? Answer. True rationale. Anxiety is common in MI due to pain and fear, increasing myocardial oxygen demand, requiring assessment, per AHA clinical evaluation. 82. All MI patients require statins regardless of cholesterol levels. True or false? Answer. True rationale. Statins are recommended for all MI patients for plaque stabilization and secondary prevention, regardless of baseline LDL, per AHA guidelines. 83. The nurse should teach MI patients to monitor their blood pressure regularly. True or false? Answer. True rationale. Regular blood pressure monitoring helps manage hypertension, a key MI risk factor, per AHA patient education guidelines. 84. MI pain is always relieved by nitroglycerin. True or false? Answer. False rationale. MI pain may not be fully relieved by nitroglycerin, unlike angina, due to ongoing necrosis, requiring further intervention, per AHA clinical manifestations. 85. The nurse should assess for peripheral edema in MI patients. True or false? Answer. True rationale. Peripheral edema may indicate right heart failure or biventricular dysfunction post-MI, requiring assessment, per AHA clinical evaluation. 86. MI can cause atrial fibrillation as a complication. True or false? Answer. True rationale. Myocardial ischemia can disrupt atrial conduction, causing atrial fibrillation post-MI, per AHA complications. 87. The nurse should administer oxygen to MI patients with chest pain. True or false? Answer. False rationale. Oxygen is indicated only for MI patients with hypoxemia, SpO2 less than 90%, not routinely for chest pain, per AHA 2020 guidelines. 88. The nurse should teach MI patients to follow a Mediterranean diet. True or false? Answer. True rationale. The Mediterranean diet, rich in healthy fats and low in saturated fats, reduces MI recurrence risk, per AHA dietary guidelines. 89. MI can cause cardiomegaly on chest X-ray. True or false? Answer. True rationale. Chronic ventricular remodeling post-MI can lead to cardiomegaly, seen on chest X-ray, per AHA imaging findings. 90. The nurse should administer thrombolytics to MI patients with recent surgery. True or false? Answer. False rationale. Recent surgery is a contraindication to thrombolytics due to bleeding risk, requiring PCI or medical management, per AHA reperfusion contraindications. 91. The nurse should assess for tachycardia in MI patients. True or false? Answer. True rationale. Tachycardia is common in MI due to pain, anxiety, or low cardiac output, requiring assessment, per AHA clinical evaluation. 92. All MI patients experience Q waves on ECG. True or false? Answer. False rationale. Q waves indicate prior MI but are not present in all cases, especially in STEMI or early STEMI, per AHA ECG criteria. 93. The nurse should teach MI patients to exercise regularly post-recovery. True or false? Answer: true. Rationale: regular, supervised exercise improves cardiovascular fitness and reduces MI recurrence risk, per AHA cardiac rehabilitation guidelines. 94. MI can cause transient ischemic changes on ECG. True or false? Answer: true. Rationale: transient ST segment or T-wave changes can occur in MI, reflecting reversible ischemia, per AHA ECG findings. 95. The nurse should monitor for hypokalemia post-MI. True or false? Answer: true. Rationale: hypokalemia can occur post-MI due to diuretics or stress response, increasing arrhythmia risk, per AHA metabolic guidelines. 96. The nurse should administer AC inhibitors to MI patients with hypotension. True or false? Answer: false. Rationale: AC inhibitors are contraindicated in hypotension, systolic BP less than 100 millimeters of mercury, due to risk of worsening perfusion, per AHA pharmacologic contraindications. 97. MI can cause syncope as a presenting symptom. True or false? Answer: true. Rationale: syncope can occur in MI due to arrhythmias or reduced cardiac output, especially in the elderly, per AHA clinical manifestations. 98. The nurse should teach MI patients to avoid excessive alcohol intake. True or false? Answer: true. Rationale: excessive alcohol can increase blood pressure and triglycerides, raising MI risk, per AHA lifestyle guidelines. 99. The nurse should assess for murmurs in MI patients. True or false? Answer: true. Rationale: new murmurs may indicate mitral regurgitation or ventricular septal rupture post-MI, requiring assessment, per AHA clinical evaluation. 100. MI can be prevented by controlling modifiable risk factors. True or false? Answer: true. Rationale: controlling modifiable risk factors like hypertension, smoking, and obesity significantly reduces MI risk, per AHA prevention guidelines. 101. The nurse should teach MI patients to report chest pain lasting more than 5 minutes. True or false? Answer: true. Rationale: chest pain lasting over 5 minutes may indicate recurrent ischemia or reinfarction, requiring immediate reporting and medical evaluation, per AHA patient education guidelines. 102. MI can only occur in patients over 50 years old. True or false? Answer: false. Rationale: MI can occur in younger patients, especially with risk factors like smoking, diabetes, or genetic predisposition, per AHA epidemiology data. 103. The nurse should monitor for signs of heart failure post-MI. True or false? Answer: true. Rationale: heart failure is a common post-MI complication due to left ventricular dysfunction, requiring monitoring for symptoms like dyspnea and edema, per AHA complications guidelines. 104. Nitroglycerin is administered intravenously for all MI patients. True or false? Answer: false. Rationale: intravenous nitroglycerin is used for persistent ischemia or heart failure in MI, but sublingual nitroglycerin is standard for initial chest pain relief, per AHA protocols. 105. An elevated heart rate increases myocardial oxygen demand in MI. True or false? Answer: true. Rationale: tachycardia increases myocardial oxygen demand, worsening ischemia in MI, necessitating interventions like beta blockers, per AHA pathophysiology. 106. The nurse should assess for epigastric pain in MI patients. True or false? Answer: true. Rationale: epigastric pain is an atypical MI symptom, especially in women and the elderly, requiring assessment, per AHA clinical manifestations. 107. All MI patients require a pacemaker post-event. True or false? Answer: false. Rationale: pacemakers are indicated only for specific post-MI complications like persistent bradycardia or heart block, not all patients, per AHA device guidelines. 108. The left coronary artery supplies the majority of the left ventricle. True or false? Answer: true. Rationale: the left coronary artery, via its branches, LAD and circumflex, supplies most of the left ventricle, critical for cardiac function, per coronary anatomy. 109. The nurse should teach MI patients to manage stress to prevent recurrence. True or false? Answer: true. Rationale: stress increases catecholamine release, raising MI risk. Stress management techniques are part of secondary prevention, per AHA lifestyle guidelines. 110. ST segment depression on an ECG indicates STEMI. True or false? Answer: false. Rationale: ST segment depression suggests STEMI or ischemia, while ST elevation indicates STEMI, per AHA ECG classification. 111. MI can cause ventricular tachycardia as a complication. True or false? Answer: true. Rationale: ventricular tachycardia is a life-threatening post-MI arrhythmia due to myocardial irritability, requiring immediate intervention, per AHA complications. 112. Troponin levels are used to monitor MI treatment progress. True or false? Answer: false. Rationale: troponin levels diagnose MI but are not used to monitor treatment progress. Clinical symptoms and ECG changes guide therapy, per ACC biomarker standards. 113. The nurse should administer aspirin to MI patients with active gastrointestinal bleeding. True or false? Answer: false. Rationale: aspirin is contraindicated in active gastrointestinal bleeding due to increased bleeding risk, requiring alternative antiplatelet therapy, per AHA contraindications. 114. Smoking cessation reduces MI risk within 1 year. True or false? Answer: true. Rationale: smoking cessation significantly reduces MI risk within 1 to 2 years by decreasing thrombosis and atherosclerosis progression, per AHA prevention data. 115. The nurse should assess for fatigue in MI patients. True or false? Answer: true. Rationale: fatigue is a common MI symptom, especially in women and the elderly, indicating reduced cardiac output, per AHA clinical manifestations. 116. MI always results in complete coronary artery occlusion. True or false? Answer: false. Rationale: MI can occur with partial occlusion or non-occlusive causes like coronary spasm or demand ischemia, per AHA pathophysiology. 117. The nurse should monitor for signs of thromboembolism post-MI. True or false? Answer: true. Rationale: post-MI ventricular dysfunction or aneurysm can lead to thrombus formation and thromboembolism, requiring monitoring, per AHA complications. 118. All MI patients require immediate cardiac catheterization. True or false? Answer: false. Rationale: cardiac catheterization is indicated for STEMI within 90 minutes or high-risk STEMI, not all MI patients, per AHA reperfusion guidelines. 119. The nurse should teach MI patients to maintain a low-fat diet. True or false? Answer: true. Rationale: a low-fat diet, particularly low in saturated fats, reduces atherosclerosis progression and MI recurrence risk, per AHA dietary guidelines. 120. Beta blockers are contraindicated in MI patients with heart failure. True or false? Answer: false. Rationale: beta blockers are beneficial in MI patients with heart failure, e.g., carvedilol, improving outcomes, unless decompensated, per AHA pharmacologic guidelines. 121. MI can cause Dressler's syndrome weeks after the event. True or false? Answer: true. Rationale: Dressler's syndrome, a post-MI pericarditis, occurs 1 to 6 weeks after MI due to an autoimmune response, per AHA complications. 122. The nurse should administer thrombolytics to all STEMI patients. True or false? Answer: false. Rationale: thrombolytics are not indicated for STEMI, which is managed with medical therapy or PCI, as it involves partial occlusion, per AHA guidelines. 123. The nurse should assess for cyanosis in MI patients. True or false? Answer: true. Rationale: cyanosis may indicate severe hypoxemia or cardiogenic shock in MI, requiring immediate assessment, per AHA clinical evaluation. 124. MI pain is always bilateral in nature. True or false? Answer: false. Rationale: MI pain is typically unilateral, often radiating to the left arm or jaw, though it may feel diffuse, per AHA clinical manifestations. 125. the nurse should teach MI patients to monitor their cholesterol levels. True or false? Answer: true. Rationale: regular cholesterol monitoring helps manage dyslipidemia, a key MI risk factor, per AHA secondary prevention guidelines. 126. A normal troponin level 12 hours post-symptom onset rules out MI. True or false? Answer: false. Rationale: a normal troponin level at 12 hours does not definitively rule out MI, as levels may rise later or be normal in early and STEMI, per ACC biomarker standards. 127. The nurse should monitor for bradycardia in MI patients with inferior wall infarction. True or false? Answer: true. Rationale: inferior wall MI, often from right coronary artery occlusion, can affect the sinoatrial node, causing bradycardia, per AHA complications. 128. All MI patients experience diaphoresis as a symptom. True or false? Answer: false. Rationale: diaphoresis is common but not universal in MI. Some patients, especially the elderly, may lack the symptom, per AHA clinical manifestations. 129. The nurse should administer heparin to MI patients with a high bleeding risk. True or false? Answer: false. Rationale: heparin is contraindicated in patients with high bleeding risk, e.g., recent surgery, requiring alternative anticoagulation, per AHA anticoagulant guidelines. 130. MI can cause heart block as a complication. True or false? Answer: true. Rationale: myocardial necrosis affecting conduction pathways can cause heart block, particularly in inferior or anterior MI, per AHA complications. 131. The nurse should teach MI patients to avoid sudden temperature changes. True or false? Answer: true. Rationale: sudden temperature changes can stress the cardiovascular system, increasing MI risk. Patients should avoid extremes, per AHA lifestyle guidelines. 132. CKMB levels rise faster than troponin in MI. True or false? Answer: true. Rationale: CKMB levels rise within 3 to 4 hours of MI, faster than troponin, 3 to 6 hours, but are less specific, per ACC biomarker kinetics. 133. The nurse should administer morphine to MI patients with hypotension. True or false? Answer: false. Rationale: morphine can worsen hypotension by causing vasodilation, requiring cautious use in MI patients with low BP, per AHA protocols. 134. The nurse should assess for nausea in MI patients. True or false? Answer: true. Rationale: nausea is a common MI symptom, especially in women, due to vagal stimulation or ischemia, per AHA clinical manifestations. 135. MI can be prevented by regular physical activity. True or false? Answer: true. Rationale: regular physical activity reduces MI risk by improving lipid profiles and endothelial function, per AHA prevention guidelines. 136. All MI patients require lifelong beta blocker therapy. True or false? Answer: false. Rationale: beta blockers are recommended long-term post-MI for most patients, but not all, depending on ejection fraction and comorbidities, per AHA guidelines. 137. The nurse should monitor for signs of pulmonary embolism post-MI. True or false? Answer: true. Rationale: post-MI immobility or ventricular thrombus increases pulmonary embolism risk, requiring monitoring for dyspnea or chest pain, per AHA complications. 138. The right ventricle is unaffected by MI. True or false? Answer: false. Rationale: right ventricular infarction can occur, especially with right coronary artery occlusion, causing hypotension and elevated JVD, per AHA pathophysiology. 139. The nurse should teach MI patients to take statins with food to reduce side effects. True or false? Answer: true. Rationale: taking statins with food minimizes gastrointestinal side effects like nausea, improving adherence, per AHA pharmacologic guidelines. 140. MI always presents with ECG changes at symptom onset. True or false? Answer: false. Rationale: early MI may lack ECG changes, especially in STEMI or small infarcts, requiring serial ECGs, per AHA diagnostic standards. 141. The nurse should assess for confusion in elderly MI patients. True or false? Answer: true. Rationale: confusion is an atypical MI symptom in the elderly, reflecting reduced cardiac output or hypoxia, per AHA geriatric considerations. 142. Thrombolytics are the preferred treatment for MI in patients with PCI access. True or false? Answer: false. Rationale: PCI is preferred over thrombolytics for STEMI when available within 90 minutes, offering better outcomes, per AHA reperfusion guidelines. 143. The nurse should monitor for elevated blood pressure post-MI. True or false? Answer: true. Rationale: hypertension post-MI increases myocardial workload, requiring monitoring and management, per AHA clinical guidelines. 144. MI pain is always accompanied by shortness of breath. True or false? Answer: false. Rationale: shortness of breath is common but not universal in MI. Some patients present with isolated pain or atypical symptoms, per AHA clinical manifestations. 145. The nurse should teach MI patients to avoid lifting heavy objects for 6 weeks post-MI. True or false? Answer: true. Rationale: avoiding heavy lifting for 6 weeks post-MI reduces myocardial strain during recovery, per AHA rehabilitation guidelines. 146. All MI patients experience elevated CKMB levels. True or false? Answer: false. Rationale: CKMB levels may be normal in early MI or small infarcts. Troponin is more sensitive, per ACC biomarker standards. 147. The nurse should assess for jugular vein distension in right ventricular MI. True or false? Answer: true. Rationale: JVD is a hallmark of right ventricular MI, indicating right heart failure, per AHA clinical evaluation guidelines. 148. MI can be caused by cocaine use. True or false? Answer: true. Rationale: cocaine causes coronary vasospasm and thrombosis, increasing MI risk, even in young patients, per AHA pathophysiology. 149. The nurse should administer ACE inhibitors to MI patients with acute renal failure. True or false? Answer: false. Rationale: ACE inhibitors are contraindicated in acute renal failure due to risk of worsening kidney function, per AHA pharmacologic contraindications. 150. The nurse should teach MI patients to report palpitations post-discharge. True or false? Answer: true. Rationale: palpitations may indicate post-MI arrhythmias, requiring prompt reporting for evaluation, per AHA patient education guidelines. 151. MI can cause ventricular fibrillation as a complication. True or false? Answer: true. Rationale: ventricular fibrillation, a fatal arrhythmia, can occur post-MI due to myocardial irritability, requiring defibrillation, per AHA complications. 152. The nurse should administer oxygen to MI patients with normal SpO2 levels. True or false? Answer: false. Rationale: oxygen is not indicated for MI patients with normal SpO2 greater than or equal to 90%, as it may not benefit normoxic patients, per AHA 2020 guidelines. 153. The nurse should teach MI patients to follow a high-protein diet. True or false? Answer: false. Rationale: a balanced diet, not high-protein, is recommended post-MI to manage weight and lipids, per AHA dietary guidelines. 154. MI can cause cardiogenic pulmonary edema. True or false? Answer: true. Rationale: left ventricular failure post-MI can lead to pulmonary edema, causing severe dyspnea, per AHA complications. 155. The nurse should monitor for signs of infection post-MI. True or false? Answer: true. Rationale: post-MI patients are at risk for infections, especially with invasive procedures like PCI, requiring monitoring, per AHA clinical guidelines. 156. All MI patients require antiplatelet therapy for life. True or false? Answer: false. Rationale: lifelong antiplatelet therapy, e.g. aspirin, is recommended for most MI patients, but duration varies based on bleeding risk, per AHA guidelines. 157. The nurse should assess for chest pain recurrence in MI patients. True or false? Answer: true rationale. Recurrent chest pain may indicate reinfarction or ischemia, requiring immediate assessment, per AHA clinical evaluation. 158. MI can only occur in patients with atherosclerosis. True or false? Answer: false rationale. MI can occur without atherosclerosis caused by coronary spasm, embolism, or demand ischemia, per AHA pathophysiology. 159. The nurse should teach MI patients to take nitroglycerin prophylactically before exercise. True or false? Answer: true rationale. Prophylactic nitroglycerin before exercise can prevent exertional ischemia in post-MI patients, per AHA Patient Education Guidelines. 160. The nurse should administer thrombolytics to MI patients with chest pain for 24 hours. True or false? Answer: false rationale. Thrombolytics are ineffective and risky beyond 12 hours of symptom onset, requiring PCI or medical management, per AHA Reperfusion Guidelines. 161. MI can cause papillary muscle rupture. True or false? Answer: true rationale. Papillary muscle rupture, a rare post-MI complication, causes acute mitral regurgitation and heart failure, per AHA Complications. 162. The nurse should teach MI patients to avoid all physical activity post-discharge. True or false? Answer: false rationale. Supervised physical activity is encouraged post-MI to improve cardiovascular health, per AHA Cardiac Rehabilitation Guidelines. 163. The nurse should monitor for hyperglycemia in diabetic MI patients. True or false? Answer: true rationale. Diabetic MI patients are prone to stress hyperglycemia, worsening outcomes, requiring tight glucose control, per AHA Metabolic Guidelines. 164. MI pain is always severe in intensity. True or false? Answer: false rationale. MI pain varies in intensity, from mild discomfort to severe, depending on the patient and infarct size, per AHA Clinical Manifestations. 165. The nurse should assess for S4 heart sound in MI patients. True or false? Answer: true rationale. An S4 heart sound may indicate reduced ventricular compliance post-MI, requiring assessment, per AHA Clinical Evaluation. 166. All MI patients experience Q waves on ECG post-event. True or false? Answer: false rationale. Q waves develop in some, but not all, MI patients, depending on infarct size and location, per AHA ECG criteria. 167. The nurse should teach MI patients to maintain a healthy BMI. True or false? Answer: true rationale. A healthy BMI reduces MI recurrence risk by decreasing cardiovascular strain, per AHA Lifestyle Guidelines. 168. MI can be diagnosed solely based on patient symptoms. True or false? Answer: false rationale. MI diagnosis requires ECG changes, biomarkers, e.g., troponin, or imaging, not symptoms alone, per AHA diagnostic standards. 169. The nurse should monitor for atrial arrhythmias post-MI. True or false? Answer: true rationale. Atrial arrhythmias, like atrial fibrillation, can occur post-MI due to atrial stretch or ischemia, per AHA Complications. 170. The nurse should administer beta blockers to MI patients with uncontrolled hypertension. True or false? Answer: true rationale. Beta blockers help control hypertension and reduce myocardial oxygen demand in MI, unless contraindicated, per AHA Pharmacologic Guidelines. 171. MI can cause left bundle branch block on ECG. True or false? Answer: true rationale. Myocardial ischemia or necrosis can cause left bundle branch block, complicating MI diagnosis, per AHA ECG findings. 172. The nurse should teach MI patients to avoid NSAIDs post-MI. True or false? Answer: true rationale. NSAIDs increase MI and bleeding risks by affecting platelet function and blood pressure, per AHA Medication Guidelines. 173. The nurse should assess for syncope in MI patients. True or false? Answer: true rationale. Syncope may indicate arrhythmias or reduced cardiac output in MI, requiring assessment per AHA clinical evaluation. 174. All MI patients require coronary artery bypass grafting, CABG. True or false? Answer: false rationale. CABG is indicated for specific MI patients, e.g., multivessel disease. Not all, with PCI or medical management often sufficient, per AHA guidelines. 175. The nurse should monitor for signs of renal failure post-MI. True or false? Answer: true rationale. Cardiogenic shock or contrast dye from PCI can cause renal failure post-MI, requiring monitoring per AHA complications. 176. MI can be asymptomatic in diabetic patients. True or false? Answer: true rationale. Diabetic patients may have silent MI due to autonomic neuropathy, presenting without chest pain per AHA clinical manifestations. 177. The nurse should teach MI patients to take clopidogrel with food. True or false? Answer: true rationale. Taking clopidogrel with food reduces gastrointestinal side effects, improving adherence, per AHA pharmacologic guidelines. 178. MI pain is always relieved within 5 minutes of nitroglycerin administration. True or false? Answer: false rationale. MI pain may persist despite nitroglycerin, unlike angina, indicating ongoing necrosis, per AHA clinical manifestations. 179. The nurse should assess for peripheral pulses in MI patients. True or false? Answer: true rationale. Weak peripheral pulses may indicate cardiogenic shock or reduced cardiac output in MI, requiring assessment per AHA clinical evaluation. 180. The nurse should administer thrombolytics to MI patients with peptic ulcer disease. True or false? Answer: false rationale. Active peptic ulcer disease is a contraindication to thrombolytics due to bleeding risk, per AHA reperfusion contraindications. 181. MI can cause ventricular aneurysm formation. True or false? Answer: true rationale. Ventricular aneurysm, a weakened myocardial wall, can form post-MI, increasing heart failure risk, per AHA complications. 182. The nurse should teach MI patients to avoid all fats in their diet. True or false? Answer: false rationale. Healthy fats, e.g., omega-3s, are beneficial post-MI. Only saturated and trans fats should be limited, per AHA dietary guidelines. 183. The nurse should monitor for signs of stroke in MI patients on anticoagulants. True or false? Answer: true rationale. Anticoagulants like heparin increase stroke risk, e.g., hemorrhagic, requiring monitoring for neurological changes, per AHA anticoagulant guidelines. 184. MI can occur in patients with normal cholesterol levels. True or false? Answer: true rationale. MI can occur due to non-lipid factors like coronary spasm, thrombosis, or inflammation, even with normal cholesterol, per AHA pathophysiology. 185. The nurse should assess for fever post-MI. True or false? Answer: true rationale. Fever may indicate post-MI pericarditis or infection, requiring assessment, per AHA clinical evaluation. 186. All MI patients require lifelong ACE inhibitor therapy. True or false? Answer: false rationale. ACE inhibitors are recommended long-term for MI patients with reduced ejection fraction, not all, per AHA guidelines. 187. The nurse should teach MI patients to recognize signs of heart failure. True or false? Answer: true rationale. Recognizing heart failure symptoms, e.g., dyspnea, edema, ensures timely intervention post-MI, per AHA patient education guidelines. 188. MI can only be diagnosed with cardiac catheterization. True or false? Answer: false rationale. MI is diagnosed with ECG, biomarkers, and clinical symptoms. Catheterization confirms coronary occlusion but isn't required, per AHA diagnostic standards. 189. The nurse should monitor for signs of gastrointestinal bleeding in MI patients on aspirin. True or false? Answer: true rationale. Aspirin increases gastrointestinal bleeding risk, requiring monitoring for symptoms like melena, per AHA antiplatelet guidelines. 190. The nurse should administer nitroglycerin to MI patients with right ventricular infarction. True or false? Answer: false rationale. Nitroglycerin is contraindicated in right ventricular MI due to risk of severe hypotension from preload reduction, per AHA protocols. 191. MI can cause pericardial effusion as a complication. True or false? Answer: true rationale. Post-MI pericarditis or myocardial rupture can lead to pericardial effusion, requiring monitoring, per AHA complications. 192. The nurse should teach MI patients to avoid caffeine completely. True or false? Answer: false rationale. Moderate caffeine is generally safe post-MI. Excessive intake should be avoided to prevent tachycardia, per AHA dietary guidelines. 193. The nurse should assess for orthopnea in MI patients. True or false? Answer: true rationale. Orthopnea may indicate left ventricular failure or pulmonary edema post-MI, requiring assessment, per AHA clinical evaluation. 194. All MI patients experience ventricular arrhythmias post-event. True or false? Answer: false rationale. Ventricular arrhythmias are common but not universal post-MI, depending on infarct size and location, per AHA complications. 195. The nurse should teach MI patients to monitor their heart rate regularly. True or false? Answer: true rationale. Regular heart rate monitoring helps detect arrhythmias or exertional issues post-MI, per AHA patient education guidelines. 196. MI can be caused by severe anemia. True or false? Answer: true rationale. Severe anemia reduces oxygen delivery, causing demand ischemia and potentially MI, per AHA pathophysiology. 197. The nurse should monitor for signs of allergic reactions in MI patients on clopidogrel. True or false? Answer: true rationale. Clopidogrel can cause allergic reactions, requiring monitoring for rash or anaphylaxis, per AHA pharmacologic guidelines. 198. MI pain is always associated with physical exertion. True or false? Answer: false rationale. MI pain can occur at rest or with emotional stress, not only exertion, per AHA clinical manifestations. 199. The nurse should assess for paroxysmal nocturnal dyspnea in MI patients. True or false? Answer: true rationale. Paroxysmal nocturnal dyspnea may indicate heart failure post-MI, requiring assessment, per AHA clinical evaluation. 200. The nurse should teach MI patients to participate in cardiac rehabilitation programs. True or false? Answer: true rationale. Cardiac rehabilitation improves outcomes and reduces MI recurrence through exercise and education, per AHA rehabilitation guidelines.